Penis is the external genitourinary organ of the male and is largely comprised of three cylindrical bodies organized distally with glans penis. One of the cylindrical bodies is the corpus spongiosum, which envelops the bulbar and penile urethra, becoming symmetric in its covering of entire urethra within the penis. The corpus spongiosum then becomes the glans penis distally. Upon erection, the corpus spongiosum engorges to compress the urethral lumen and facilitate higher emission velocity, while the glans engorges to facilitate penetrative intercourse and absorb impact during thrusting. The corpus spongiosum protects the urethra and facilitates urethral blood flow. Remaining two cylindrical bodies are the paired corpora cavernosa. Each corpus cavernosum is contained within a fibrous tissue layer called tunica albuginea, which serves to support the engorged corpora cavernosa during erection as they fill with blood near the arterial pressure. The corpora cavernosa serve no urinary flow. Overlying these cylindrical structures are the deep penile fascia, which is called as a Buck's fascia, superficial perineal, which is called as Cooley's fascia, which is superficial to this, which extends from the membranous superficial fascia, which is called as Scarp's fascia. Overlying this is the penile skin, which is naturally redundant and elastic, such that it can expand during the erection and retract when non-erect to facilitate urination. Penis is a highly vascular organ that is also rich with innervation. Most sensation in the penis is conveyed via the paired dorsal nerves, which are coupled with the arteries as neurovascular bundles, traveling bilateral to the dorsal most aspect of the penis. The nerves responsible for the erection are the terminal branches within the penis and are located throughout the stroma inside corpora cavernosa, where they stimulate erection through a complex molecular cascade. Little bit about penile vasculature. Internal iliac arteries give rise to the bilateral internal pudendal arteries, which subsequently give rise to the common penile arteries that perfuse the penis and most of urethra. Accessory arteries may also supply this form to the obturator or inferior vesical arteries. Common penile artery branches into the dorsal, cavernous, and bulbourethral arteries. Circumflex arteries provide communication between the dorsal artery and corpus spongiosum or bulbourethral artery at varying points along the length of penis. Cavernous artery supplies the corpora cavernosa. Dorsal artery supplies the skin and glans. You guys now seeing this is the erect penile structure. Venous return in the penis largely mirrors that of the arterial supply. The deep dorsal vein drains into the periprostatic plexus, while the bulbar and the cavernous veins merge into the internal pudendal vein. Additionally, the superficial dorsal vein drains into the femoral vein via the superficial external pudendal vein. So basically in the penis there is muscular organs, corpora cavernosa, Corpus spongiosum. Corpus spongiosum also has septi but is considerably smaller in the diameter. Corpus spongiosum has no tunical investment to constrain it and produce rigidity during the erection. Urethral mucosa varies along the length of penis. Proximally, it is lined by urothelium and distally by squamous. Carpora cavernosa are made up of smooth muscle septi interweaved within and around vascular cavities. The deep layer of tunica albuginea is comprised of circular oriented fibers, while the superficial layer is comprised of fibers longitudinal oriented along the penis. This is a complex structure where you can see there is a various arterial involvement encircling the whole penis. Thank you.